بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته. أعزائي طلاب وطالبات المستوى الرابع، برنامج بكالوريوس طب وجراحة الفم والأسنان. أهلا وسهلا ومرحبا بكم في اللقاء الثاني من لقاءاتنا التعليمية في مقرر طب الفم. في هذا اللقاء سنتحدث عن clinical examination. As we studied in the last lecture, we had talking about the clinical we had talking about the patient history and the diagnosis. And we was emphasized on the history of the patient regarding the present complaint history and the social history, medical related history and dental history of your patient. After we finish taking the history from your patient using the specified case sheet, we will talk the diagnosis. The last lecture we had talking about the types of diagnosis related to oral medicine. We was emphasized on the differential diagnosis, which is very important type of diagnosis, helping you in reaching the final diagnosis of your clinical presentation of your patient's case. In this lecture, the second lecture, we will continue about the steps which help us to reach the final diagnosis, which is the clinical examination. After we finish to take a thorough history from your patient, we will continue to take the clinical examination regarding oral and intraoral, extraoral clinical examination. The learning outcome of this lecture, the second lecture, all the students should be able at the end of this lecture to describe the basic intraoral and extraoral steps of clinical examination. As well as the students also should be able to perform the general examinations for the patient regarding the general health, the general condition of your case. The students also should be able to correlate between the clinical findings and the supposed medical problems. What is the clinical findings of your patient, of your case, and what is the correlations with the general systemic condition of your patient. The students at the end of this lectures also should be able to perform systematic oral clinical examination. We will talk about the physical examination and assessment of the general condition of your patient, as well as how to perform extraoral and intraoral clinical examination regarding your case. What is the intraoral examination in detail, and how you will be able to perform a systemic clinical intraoral and extraoral clinical examination. All these topics and subheadings will talk about it in this second lecture. Physical examination includes, this is about the general examination, extraoral examination and intraoral examination. When the patient came to you complaining from oral pain or dental pain, not just to run to the oral cavity and examine the oral cavity. You should examine the patient generally, and also to look about the overall appearance of the patient. If the patient has a clubbing fingers, if the patient has a nodes in his fingers, this may be related to other systemic diseases. Assessment of the general condition of the patient, the appearance of the patient, if there is any abnormal appearance or behavior of the patient, pupil size of the patient, conscious level of the patient, as well as the movement of the patient, if there is any tremor or whatever, the posture of the patient, how the patient stand in front of you. This is a clubbing finger of the patient, which might be a symptom of cardiovascular diseases. About the assessment of the general condition of the patient, also we need to look about the face of the patient, color of the face of the patient, breathing of the patient, speech, how the patient talk with you, facial color as we mentioned, sweating, if there is any sweating or wasting. Diabetic patient may become with sweating. Patient with hepatitis B or liver cirrhosis or liver failure will came to you with yellowish discoloration. Vital signs of the patient, the conscious state, the temperature of the patient, the pulse and the blood, and also the respiration of the patient. extraoral head and neck examination. After we finish the general examination of the patient, we will move to the extraoral head and neck examination, starting with the face. How the face of the patient look like. If there is any swelling of the patient, it might indicate an inflammatory or neoplastic lesion. If there is a pallor, shuhub, in the patient's face, might indicate an anemic patient. If there is rash, as we see in this picture, this is a butterfly, we called it a butterfly rash. Maybe there is a systemic lupus erythematosus or mitral valve stenosis. If the patient's face has erythema, may related to fever or infection. If there is any asymmetry of the patients, this may indicate Bell's palsy or facial hypertrophy. As we see, this patient complained with Bell's palsy or facial nerve paralysis. On the eyes, if the patient has exophthalmos, جحوظ عيني, so this indicate thyrotoxicosis, jaundice, liver diseases, hepatitis B or liver cirrhosis or whatever. If the patient eyes has redness, so may indicate a Sjogren syndrome. Sjogren syndrome may manifested in the oral cavity as a dry mouth. For example, scarring of the eye may indicate pemphigoid. We will talk in detail about pemphigoid in the red lesions lectures. Number 3 in the extraoral head and neck examination is the swelling is the neck. We will assess the neck if there is any swelling, sinuses, cervical lymph nodes and salivary gland, thyroid. This patient complained from the swelling at the neck that may indicate any cyst or any cervical lymph node or lymph adenopathies. Also, we need to examine the salivary gland and also the thyroid glands. This is the manner how to examine the thyroid gland. Instruct the patient to swallow and you will put your both hands over the thyroid cartilage. Lymph node examination should be done in detailed and you must take into consideration how to examine the lymph nodes clearly and truly, including the following: the texture of these lymph nodes and the consistency of these lymph nodes and the nature. The normal lymph nodes are not palpable. If there is any infection or tumor in any other pathosis in the oral maxillofacial area, the lymph nodes will be palpated, swallowed, and also you need to differentiate if there is any pain, it is painful or painless. Tenderness, if the patient responds to the examination. Is this lymph nodes attached to the underlying tissue or not? If it is attached to the underlying tissue, or what we called it fixed lymph node or attached to the underlying tissue, so may indicate a serious malignant lesions. Number 4, temporomandibular joint examination. We're still talking about extraoral head and neck examination. Temporomandibular joint, facial symmetry, if there is any growth under development in any one of the condyles, there is a facial symmetry. Or masseteric hypertrophy, when the patient chew cut for long time, there may be developed with masseteric muscle hypertrophy. Mandibular opening and closing paths, you need to instruct your patient to open his mouth and close many times, so you will detect if there is any deviations for the right or the left side. Mandibular opening extent, if there is an normal interincisal distance at the maximum mouth opening. If there is no maximum or normal interincisal distance, so the patient might complain with trismus. Lateral excursions and joint noises may be due to disc disorders, or may be due to any degenerative diseases of the TMJ. Both condyles, tenderness, pain, and abnormal movement should be examined, and also if there is any clicking. In the examination of temporomandibular joint, you might need to use a stethoscope to assess if there is any sounds or clicking or other abnormalities. Then you have to examine the muscles of mastications. Muscles of mastications, we have the four main muscles of mastications: the masseter muscle, temporalis muscle, lateral pterygoid, and medial pterygoid muscle. All those four main masticatory muscles must be examined and evaluated clearly. The masseter muscle, this is the masseter muscle, and temporalis muscle presented here in the temples, and the lateral pterygoid muscle and the medial pterygoid muscle. This is the lateral pterygoid muscles, two heads, and this is the medial pterygoid muscle. Then you have to examine the salivary glands. We have three main salivary glands. We have the parotid gland and the submandibular and the sublingual glands. All these three main or major salivary glands should be examined. You have to examine the gland itself and the duct of this gland and also the orifice of this duct. Parotid duct opening and papilla should be examined, which is presented in the buccal mucosa opposing to the second molar. Submandibular gland and the duct opening papilla, which is presented in the floor of the mouth at the tip of the sublingual frenum, and also the sublingual gland should be also examined. You need to examine these major salivary glands and inspect them and palpate it for facial symmetry if there is any swelling, enlargement of these glands, salivary flow, is the gland is functioning or not, salivary appearance, if the saliva is clear, colorless secretions or purulent exudate, there is a purulent exudate or pus in the salivary gland secretions, and also you will assess if there is any tenderness on one of the major salivary gland. In the extraoral head and neck examination, we have also the examination of the cranial nerves. As we studied before, there is a 12 cranial nerves. All these cranial nerves should be examined. Most important relevant to the dentistry are the facial nerve, trigeminal nerve, glossopharyngeal nerve, and the hypoglossal nerve. Hypoglossal nerve is the 12th cranial nerve. Glossopharyngeal is the 9th cranial nerve. Trigeminal nerve is the 5th cranial nerve, and also we have the 7th facial cranial nerve. The other cranial nerves are the olfactory nerve, optic nerve, oculomotor nerve, trochlear cranial nerve, as well as we have the trigeminal nerve, the abducent nerve, facial nerve, and also the vestibulocochlear nerve. The glossopharyngeal nerve, as we mentioned above, is the 10th cranial nerve, the 9th cranial nerve, vagus nerve, axillary nerve, and also the motor of the tongue, what we called it, the motor of the tongue, the hypoglossal nerve. Then we will move to the intraoral examination. So in this lectures, we had talking about the general examination of the patient, moving to the extraoral examination, and then to the intraoral examination. Starting with the lips of the patient, you should examine the lips of the patients and assess if there is any cyanosis, which may indicate a cardiovascular diseases. If there is any cyanosis, إزرقاق in the lips of the patients may indicate cardiovascular diseases related to oxygen deficiency. Angular cheilitis at the angles of the mouth might be indicate candidiasis or iron deficiency or vitamin deficiency also. Papules can be also presented in the lips, like Fordyce spots. We'll talk about the Fordyce spots in the lecture of the normal variations. Moving to the cheek and buccal mucosa intraorally, you should examine the buccal mucosa and the cheek, which are commonly presented with the oral lesions. We will look about and assess if there is any Fordyce spots. Linea alba, which is a white line opposing the occlusal surface, presented in the buccal mucosa. Hyposalivation, if there is any dryness or hyposalivation, we will assess it in the buccal mucosa. Lesions, if there is white lesion or red lesion or whatever, so these pictures presented with white lesions, there is a reticular white lesions. We'll talk about white lesions in 2 lectures in details. If there is also lichen planus or leukodema in the buccal mucosa, we will assess it and evaluate the presence of those lesions. Number 3 in the intraoral examination is the floor of the mouth examination. So we started with the lips, moving to the buccal mucosa, and moving to the floor of the mouth. Floor of the mouth and the ventral surface of the tongue should be assessed and evaluated. So many of the lesions, especially in the patients who take snuff or shuaqat, there is a serious lesions in the floor of the mouth. So you should to visualize, observe, and also palpate manually. Manually means that you should use your both hands, left and right hands, manually to detect if there is any abnormalities in the floor of the mouth. The Wharton's duct is the duct of the submandibular salivary glands, presented as a two papilla hair in the floor of the mouth at the end of the sublingual frenum. Must try to observe if there is any secretion of this gland or not. Does the lesions, if there is a white lesion, does this lesions can be wiped off, can be rubbed off or not? So this is differentiate these lesions from other lesions. If the lesion can be rubbed off, so we can indicate there is might be a candidiasis or whatever. If the lesions cannot be removed, cannot be wiped off, so it might be a leukoplakia or other white lesion. This patient complained from the oral squamous cell carcinoma at the floor of the mouth, and the floor of the mouth is the most dangerous area in the mouth, and it is a common site of oral cancer. After finishing examination the ventral surface of the tongue and the floor of the mouth, we will move to the gingiva. We will inspect the gingiva for its color. If there is any pigmentation related to any systemic causes or local causes might be due to amalgam restorations or whatever, and systemic causes might be due to Addison disease or might be physiological melanin pigmentation. The tone of the gingiva, if there is gingivitis or any other periodontal disease. The texture of gingiva should be also examined. Architecture and mucogingival relationship, if there is any recession or other lesion of the gingiva. As well as in the gingiva you should examine how the gingiva is affected, is generalizedly affected or localized marginal, erythematous or fibrous. If the lesion is fibrous, different totally from erythematous lesions. Fibrous lesions might be as these lectures, and erythematous bases, erythematous appearance of the gingiva might be associated with erythema multiforme or pemphigoid or other plasma cell gingivitis or other lesions. Marginal versus generalized gingivitis. If there is just inflammation on the marginal area of the gingiva, maybe plaque-induced gingivitis. Or if there is a generalized gingivitis including the marginal gingiva, the attached gingiva reaching the mucous membrane of the oral cavity. This may indicate other disease other than plaque-induced gingivitis. Also, the gingiva might be exposed to the side effect of drugs used for systemic conditions such as anti-epileptic drugs and calcium channel blockers, and also the immune suppressant. Some of those drugs related with gingival overgrowth and some related with erythematous gingivitis. Moving to the hard palate intraorally, and examine the hard palate from the presence of minor salivary gland diseases like cyalometaplasia, and if there is a syphilitic ulcer, which most commonly presented in the hard palate. Also the attached gingiva. Note the presence of tori if there is any maxillary tori, torus palatinus, or any other bony exostosis. The soft palate of the patient should be also examined. How does the soft palate rise up on the patient? Say vibrating line, tonsillar pilaris, tonsils, and oropharynx. You may need to use a tongue depressor to depress the tongue and observe the posterior part of the mouth. Moving to the oropharynx, you need to assess if there is any change in the color, consistency of the tissue of the oropharynx area. Look back beyond the soft palate. Note occasional small globules and or the pink opaque tissue which are normal and may include lymph node tissue. When you examine the intraoral tissues, you must differentiate between the normal variants and the other abnormal diseases. We'll take this information in the lectures of normal variations. Moving in the intraoral examination, reaching the tongue. Tongue examination is the very important part of intraoral examination, since the tongue is one of the most common sites of oral cancer and other lesions. The tongue and the floor of the mouth, as we mentioned, the most common places for oral cancer to occur. You have the patient to protrude their tongue. Ask the patient to protrude their tongue. We may need to use a gauze to cut the tip of the tongue and pull it outside. Wrap the tongue in a dry gauze and gently pull it outside from the patient's mouth to observe the lateral borders. You need to emphasize on the examination of the lateral borders of the tongue, so it's the most common site of the lesions on the tongue. The tongue also might be affected with other lesions, which may be normal variance lesions or other lesions. Filiform papillae, fungiform papillae, circumvallate papillae are the papillae presented in the dorsal surface of the tongue and should be examined also. Lingual varicosities. Lingual varicosities is the sublingual veins, may be dilated. Especially in the old patients, and also we can find a fissure tongue or erythema multiforme or lichen planus or erythema geographic tongue, or what we called it geographic tongue. Signs of nutrition deficiencies and immune dysfunctions. Nutrition deficiencies can be presented in the tongue as a dry, depapillated tongue, and also we need to examine the tongue for hypoglossal nerve palsy, asking the patient to protrude and move his or her tongue. Also, you need to examine the tongue from the presence or the absence of the oral cancer. In the intraoral examination, also you need to examine the maxilla and mandible hole, size and shape and contour of the mandibular jaw or the upper jaw, pre-prosthetic treatment if there is any need for pre-prosthetic treatment, tori removal as we see in these pictures, tuberosity reduction in the upper arch, soft and hard tissue or both. If there is soft or hard tissue need to surgical removal, ebulus fissuratum. This is a lesion regarding or associated with prosthesis or what we call it a removable partial dentures or complete dentures. If there is ill-fitting denture, ill-fitting denture can lead to overgrowth in the mucosal membrane and mucosal tissue, leading to what we call it a ebulus fissuratum. This hard palate presented with nicotinic stomatitis. The patient is smoker, as well as this picture. This is red pinpoint dots are the minor salivary glands with inflammation, minor salivary gland duct openings. Number 11 is the occlusion. You need also to examine the occlusion of the patient. If there is any bony defects or bony lesions, there is maybe a malocclusion. Orthodontic classification of the patient should be mentioned. If there is any interferences may lead to traumatic ulcer, to frictional keratosis, to other oral lesions. So you need to do a systematic oral examination. Systematic oral examination means that done at initial exam, at recalls, unless patient history requires sooner. You must visualize all areas of the oral cavity, as we mentioned before, starting from the lips, finished with the occlusal status of the patient. This is number 1. This is number 11. Moving with the tongue and buccal mucosa and the floor of the mouth and the vestibules of the patients and the maxilla hole and mandibular jaw, salivary glands, temporomandibular occlusal associations, and so on. Oral cancer can occur in other places, not just emphasize or concentrate in the floor of the mouth and the tongue for finding the oral cancer. Oral cancer can be or might be found in other places than the tongue and the floor of the mouth. Be complete. Examine all the parts of the oral cavity. Do good. Don't harm the patient. Do justice and respect the anatomy of the patient. Respect the anatomy. So, starting with the lips, if there is any herpes labialis, if there is cheilitis, if there is mucoceles, which is a minor salivary glands or salivary gland diseases, granulomatous conditions can be presented in the lips. The palate can be presented with torus palatinus with stomatitis nicotina, as we see in the last picture in the smoker patient, pemphigoid and pemphigus. All these lesions can be presented in the palate. The tongue can be presented with geographic tongue, what we call it benign migratory glossitis, and burning tongue syndrome, and maybe the patient presented with aphthous ulcer in his or in her tongue. The teeth should also be examined. The swelling, the facial swelling, may be related to the dental origin, to pulpitis, to dental abscess, to preapical abscess. Soft palate should be also examined, uvula of the patient, tonsils, and also the tongue, as we mentioned. The buccal mucosa should be assessed and evaluated if there is any leukodema, white lesion, or linea alba as a white lesion, cheek biting, aphthous ulcer, and lichen planus, or any other pigmented or red or white lesion. In conclusion, in this lecture, which is the second lecture of our course, we had talking about physical examination of the patient and assessment of the patient general condition to assess if there is any systemic disease this systemic disease may be related to the oral finding as an oral manifestation. So these lesions should be treated for the systemic condition, removal of the cause, and the oral finding or the oral lesion will be resolved. Then we move to the extraoral head and neck examination. We had talking about this in detail, starting and moving from the TMJ examination, neck examination, and the facial appearance, and so on. Intraoral examination, starting from the lips, finishing with the occlusion of the patient, moving to the buccal mucosa, to the vestibule, to every piece of the oral cavity. And finally, we had talking about the systematic oral examination, emphasizing to be complete and to respect the anatomy of the patient. The anatomy. So the student must revise the subject of oral anatomy, of head and neck anatomy, so he can differentiate between the normal variations and the pathological findings of the oral cavity. The assignment of the second lecture: the student must perform a thorough clinical examination for your friend, considering all aspects of the extraoral and intraoral examination. So each student must perform a thorough clinical examination in front of the supervisor in the clinical sessions, performing an oral examination, general examination, extraoral examination, and intraoral examination for his or her student friend. This assignment also will be provided in the assignment section of this course as a Word document under the title of assignment 2. Thank you very much, dear students, for your listening.